It's the middle of the night, your child is burning up with a fever, and you're staring at a disorganized medicine cabinet filled with syrups, wondering which one is actually safe to use. In that moment of panic, it's incredibly common to try and guess the dosage based on the child's age, or simply grab whatever kitchen spoon happens to be closest. That guesswork creates an immediate, dangerous trade-off. If you underdose, the fever won't break. If you overdose, you're placing immediate, toxic stress on your child's organs. There is one non-negotiable rule in pediatric medicine to avoid both of these outcomes. Exact body weight, not age, must dictate the dosage math. Today, we are going to map out the 12 most common pediatric syrups, linking them to their exact scenarios and their strict mathematical dosages. Replacing panicked guessing with precise weight-based math guarantees the medication will actually work, while shielding your child's body from accidental toxicity. When managing fevers and mild pain at home, your primary and safest tool is always paracetamol. Take a look at this calculation. The standard paracetamol dose is 10 to 15 milligrams per kilogram of body weight every 4 to 6 hours. But exceeding that interval pushes the liver into toxicity. It attacks the organ without curing the underlying infection. If you are dealing with heavier pain or severe inflammation, ibuprofen serves as the secondary option. The math for ibuprofen is different: 5 to 10 milligrams per kilogram of body weight, administered every 6 to 8 hours. There is a strict safety boundary here. Ibuprofen must never be used for infants under 6 months old without explicit clearance from a doctor. These first-line defenders buy time and provide comfort, but remain safe only if strict weight-based math is followed to prevent internal organ stress. When dealing with respiratory issues, this decision tree differentiates a dry allergy from a wet cough. Following the runny nose path, the solution is cetirizine, 2.5 milligrams for kids 2 to 5, and up to 10 for older children. Warning: cetirizine induces significant drowsiness. For severe nighttime allergies, doctors step up to montelukast and levocetirizine. Montelukast requires 4 to 5 milligrams administered at night. Panning back to the wet cough path, heavy mucus requires medications like terbutaline and bromhexine to actively thin it. These mucus thinners carry high risks, including rapid heart rate and tremors. They strictly require medical supervision and should never be used on a guess. Correctly matching the exact physical symptom to the appropriate airway syrup prevents parents from accidentally inducing severe drowsiness or triggering dangerous heart palpitations. This brings us to the most misunderstood and overused category in the entire medicine cabinet: antibiotics. This chart breaks down the fundamental medical divide. Antibiotics eradicate bacteria, but are powerless against viral fevers. Focusing strictly on the bacterial quadrant, azithromycin targets throat or lung bacteria, dosed at exactly 10 milligrams per kilogram given once daily. For ear, throat, and urinary tract infections, cefiximine is often the preferred choice, administered at 8 milligrams per kilogram daily. Then there is amoxicillin combined with clavulanic acid, a heavy-hitting combination that requires a much larger dose of 25 to 45 milligrams per kilogram. Demanding these antibiotics for viral symptoms is a terrible trade. It offers short-term peace of mind, but actively breeds antibiotic-resistant superbugs inside your child's body over the long term. Pivoting to stomach issues, the most immediate crisis parents face is acute vomiting and nausea. Ondansetron is highly effective here at 0.15 milligrams per kilogram. However, abruptly stopping vomiting can mask deeper gut problems, requiring a doctor's sign-off. For clearing intestinal worms, albendazole uses a strict age-stepped single dose, 200 milligrams for toddlers, junting to 400 milligrams for kids over 2. Issues like severe constipation are treated with lactulose. This syrup provides relief by physically pulling water into the bowel to soften hard stool. To correct anemia, iron supplements are deployed. This systemic boost to the red blood cells requires 3 to 6 milligrams per kilogram daily. Iron takes a long time to build up in the system, and it will harmlessly darken the color of the child's stool. Unlike instant fever relievers, these medications require precise clinical diagnoses and a much longer timeline to show safe results. Before you close your medicine cabinet, you need to audit it for the red zone, outdated formulations that must be immediately purged from your home kit. Look closely at this checklist. Ofloxacin syrups, ofloxacin combined with metronidazole, and dicyclomine all get a hard cross mark. The perceived convenience of keeping an old quick fix directly exposes your child to severe side effects that violate modern pediatric safety standards. Throw them away. Your ideal safe home setup is actually very simple. Strictly maintain paracetamol for fevers and cetirizine for acute allergies, and deploy them using exact weight calculations. Advanced interventions, like mucus thinners and antibiotics, must be left entirely to a pediatrician's prescription. Delivering the correct medication, calculated through precise weight-based math, at the appropriate time is the ultimate blueprint for protecting your child's health.